The second dimension, failing to develop on schedule, will appear about 2 to 3 years after the first. And this is known as the attention deficit, but it isn't. Here again, we have a misnomer. There are at least 6 or 7 kinds of attention and supporting networks in the human brain. They are not all disrupted by this disorder. What we want to know is which one. To help us with differential diagnosis, to help us tell ADHD from an anxiety disorder and from autism, and all the other psychiatric disorders, which all interfere with attention at some point in life, ADHD is not the only attention deficit. We need to be more precise. If someone comes to us and says, my child or I am inattentive, that is useless diagnostically. What I need to know is the nature of the inattentiveness. And we have now known for a decade that the inattentiveness that we see in ADHD is distinct from that produced by all other disorders, because it is most, I think, accurately described as a failure of persistence. The first attention problem is persistence toward a goal. Notice that this implies behavior, motivation, and the future. That is very important. The other forms of attention do not. ADHD is not a problem of perception, of filtering, of processing, of how the posterior part of our brain functions. It is a problem with the motor part of the brain, this frontal lobe. Can you sustain action toward a goal adequately to attain it? That implies a motivation deficit, and that is true. And it implies future-directed behavior, and that is true. ADHD is a failure to direct behavior forward in time. We cannot persist toward these delayed endpoints in life, the tasks, the goals, the things that need to get done. So persistence is deficit 1 in the area of attention. Now, to persist toward a goal, you must be able to resist distractions. But that, too, is not a perceptual issue. It is a motor issue. The person with ADHD does not have problems with perceiving distractors better than others. It is that they respond to distractors more than others. And that is an inhibitory failure, not a perceptual difference. You and I may all hear the noise in the kitchen. The person with ADHD is compelled to react to it. Oh, did you hear that? I guess they're washing dishes. Maybe I'll stop in and take a look. Did you know I was a dishwasher when I was back in college? That's how I earn my way. Do you see what's going on here? You all heard the dish, but it was irrelevant to what we're here to do today. But to the ADHD individual, the distraction is going to provoke a response, and the response can't be inhibited. And now they're off to the races, skipping from one thing to another to another. Now,